Hi, my name is Cynthia. How are you today?
Good.
What's your name?
Lucas Vagnozzi,
Date of birth?
07/25/2000.
Where are you right now?
At the doctor's office.
Who's our president?
Joe Biden.
Do you remember what my name was?
Cynthia Bennett.
Patient's alert and oriented, person, place, and time. Patient does not present any distress of anxiety or depression. Patient answers appropriately when prompt. Patient's blood pressure was 120/70, temp 98.6, respirations 20, pulse 60, O2 100%. And I will start my exam. Alrighty. So I'm going to start with optic nerve number 1, which is the olfactory. I'm going to start with cranial nerve number 1, which is the olfactory nerve. Can you close your eyes? And can you put your finger on one nostril? Tell me what you smell.
I'll go out back.
All right. Can you put your hand on the other nostril and tell me when you smell something?
I'll go out back.
Okay, thank you. I am now going to assess optic nerve number 2. I'm going to check his pupils restriction. I'm going to check his peripheral vision, and we'll start now. All right. And this is cranial nerve number 2. Perfect. Perfect. Pupils reactive equally, and they constrict 2 to 3 millimeters. All right. Tell me when you see my hands.
I see it.
All right. Tell me which hand you see.
Right.
Again?
Right.
All right.
Left.
Okay.
Right.
All right. Perfect. I'm also going to perform the eye exam chart, the Snellen. Can you please cover one of your eyes and read the letters that you can read?
OLCF.
All right. Can you cover the other eye?
OLCF.
Perfect. Can you just follow my finger without moving your head? Perfect. Perfect. I am now going to assess cranial nerve 3, which is the ocular motor. Cranial nerve 4, which is the cochlear, and cranial nerve 6, which is the abducens. And I'll assess that with making a H sign with the patient following my hand. Perfect. I am now going to assess cranial nerve number 5, which is the trigeminal nerve. Can you please close your eyes and tell me when you feel a touch?
The chin. Left cheek. Right cheek. Forehead.
Perfect. I'm going to put my hands on your face. I did wash my hands. I want you to push against my hand. Turn your head and push towards my hand, your neck. Perfect. Can you also push your tongue against that side of your mouth and push against my hand? Perfect. I'm going to check the trapezium. I'm going to hold your shoulders down, and I'm going to stand behind you. And I just want you to shrug up. Perfect. Alrighty, so now I will be assessing cranial nerve number 7, which is the facial nerve. Can you smile? Can you frown? Can you raise your eyebrows? Perfect. I'm going to assess cranial nerve number 8, which is the acoustics nerve, and I'll assess that by the whisper test. Tell me what I say in your ear.
Hee-haw.
Perfect. I'll say it again.
Rodeo.
Perfect. I will assess cranial nerve number 9, which is the gag reflex, cranial nerve number 10, which is the vagus nerve, and cranial nerve number 12, which is the hypoglottis. So please open your mouth. Stick out your tongue. Say ah.
Ah.
All right, gag reflex is present. Vagus, the uvula rises symmetrically, so that's also present. Move around your tongue. cranial nerve 11 is present as well. Alrighty, thank you. With that, I will now do the finger test to test your sensory motor skills. So we're starting with your cerebellum skills. So take your finger and put it to your nose. Take it back. Touch my finger. Touch my finger. Touch my finger. All right. I am now going to test his coordination. I want you to hold your arms up. Push against me. Pull against me. Perfect. Turn your arms down. Push against me. All right. Push against me. Perfect. I want you to stand up. I'm checking his gait and his motor skills. I want you to put your eyes out. Put your feet together, close your eyes, and put your arms out. No, like this. I'm checking to see if he sways. That's the Romberg test. Sit down, and I can check his pronator. If his arms dropped, then, I know he'd have some problems with his pronator. Great. So now I want you to turn around, and I want you to put one foot in front of the other and walk in a straight line. Perfect. Turn around. Okay. I want you to walk on your heels. Perfect. All right, have a seat. I need to do a shin to heel test. Can you take your heel and rub against your shins? And do the other foot. Rub against your shin. Down. Go up. Down. Perfect. I will now check your reflexes. So, all right, I will start with your patellar. So you have to hold your legs regularly and just relax. Perfect. Perfect. I'll check your Achilles. Feet supposed to go up. Perfect. I'm now going to check your bicep reflex. Hold your hand like this. Okay, can you work with me? All right. So his biceps supposed to jump along with the forearm. Perfect. A little reflex there. I'll do it again here. Perfect. I'm going to check your your tricep reflex. Perfect. Perfect. Can you lay down? I'll check your bottom of your feet. This is the plantar's reflex. Can you just hold your feet up a little bit? This is the Babinski. You feel it?
Yeah.
Yes. And you jump. Let me see your other foot. Perfect. Sit up. I forgot to check. Squeeze my fingers. Good. Strength equal bilaterally in both arms. Reflex presence bilaterally in both arms. I will now do pressure points. So pressure points can cause pressure injuries. Well, we used to call them pressure ulcers. We now call pressure injuries. They can be located in your lower back, your sacrum, your coccyx, your heels, even your shoulders. And that's just because you're in a position for a prolonged period of time. And it usually happens to individuals in nursing homes, if they have neural challenges, poor nutrition, or if they're just unable to ambulate or move around on their own. So what happens is the skin usually breaks down. So blanching is when you touch the skin and it turns white if there's a pressure ulcer starting to formulate. Obviously you have none. Stage 1 pressure, there is no blanching. It's just damage to the epidermis. And usually there's no breakdown in the skin, but it's starting to turn red. Stage 2, there's breakdown of the epidermis and the dermis. And the skin is broken, and there's also no blanching. Stage 3 is breakdown of the epidermis, dermis, and subcutaneous tissue. It could even have some tunneling. That's when we need to make sure that the patient wound is clean, dry, and intact. Stage 4 is also a breakdown of muscle tissue. Stage 5 is a breakdown of, it's the worst pressure ulcer ever. That's when eschar is present and slough is present. And pressure ulcers come from like when patients are incontinent, like I said, when they're immobile, or just injuries to their skin. So it's important when you have a patient and you know that they have some neural issues, we also have to make sure we check their skin as well. All right, thank you.
Good dog.